cause of arthritis? I think the answer to that question first would have to be answered by what is arthritis? So arthritis is nothing more than the cartilage on the end of the bone wearing down. All of our bones have cartilage, kind of like the tread in a tire. And so when that wears down, that surface, that tread wears down, that's what arthritis is. Now, there's a lot of different causes. I think the most common cause is your osteoarthritis, which is wear and tear arthritis. Over the years, just like a tread on a tire, our bodies don't have the ability to repair ourselves as well as we used to. So little by little, the cartilage on the end of the bone wears down, and that's some of that has to do with genetics. Some of us get the Michelins, some of us get the Kmart retreads, and most people get stuff in between. So some of that has to do with genetics. Some of it has to do with your own, wear and tear, how you beat your body up. If you're overweight, your diet, so exercise, there's a lot of different factors, but the number one cause of arthritis is osteoarthritis. Now, there's also rheumatoid arthritis, where your body attacks itself. It's an autoimmune disease. So our bodies, unfortunately, sometimes can attack ourselves, and there's all kinds of different autoimmune diseases. Lupus is one of them. Psoriasis or psoriatic arthritis, rheumatoid arthritis. Those are all autoimmune diseases that can attack the lining of our joints and thereby also the cartilage in our joints by causing too much inflammation. You can have an infection in your knee. If you unfortunately get an infection in your knee, the infection can break down the cartilage and that can wear down the tread earlier than it would normally wear it down. So that can cause arthritis. That's kind of post-infectious or what we call post-traumatic. Post-traumatic, meaning after an injury, would also be something like playing football in high school, tearing your ACL, tearing the shock absorber cartilages, because in the knee you have the meniscus cartilage, which is the shock absorber cartilage, and then you have the cartilage on the end of the bone, which looks like the white on the end of a chicken bone, and like we just talked about, the tread on a tire. Well, those meniscus cartilages are shock absorbers, and they protect the cartilage on the end of the bone. So if they tear, that can cause increased wear and tear, and your knee to wear out faster than it would if you hadn't injured it. Also, if you tear your ACL or one of the main ligaments in the knee and the knee is unstable and it's giving out all the time, that excess pressure and all the micro injuries and injuries, repetitive injuries from it giving out can cause that tread to wear down. So that's called post-traumatic arthritis. There's some other things that can cause it, like gout is kind of like an autoimmune disease, but it's not really an autoimmune disease. It's more of a metabolic disease where you have too much uric acid in your bloodstream, and uric acid comes from eating proteins and things like that. So, but number one, most common cause of arthritis is osteoarthritis, wear and tear arthritis.